tail is vets.
Okay.
Hey Siri, flip a coin.
We could do that.
Tails. What was tails again?
Hi guys, welcome back.
Hi. Alright,
Shane
sorry.
has his bright-eyed and bushy tail today.
Yes. Hey guys.
Bridget, what are we talking about?
What do we got?
Today, you know, but all of us have recently experienced with clients a lot of vet issues, so we thought we would elaborate on your vet, how to have success at the vet, and maybe when it's time to find a new vet and do a little shopping, so we can have vet experiences be a lot smoother.
My experience, I don't have personally a bad experience with the vet, but obviously working with dogs, I get a lot of clients whose dogs struggle with the vet, or you know, just whether it's anxiety, whether it's reactivity, aggression, whatever it may be. So we've done a lot of practice with kind of handling and everything. But I know you guys both have kind of your own personal experience as well as obviously clients' experiences as well. What would you guys say, because I don't have a personal experience, what would you say are like the biggest red flags?
Of going
Whether
to a
your
vet?
whether your personal experience or just hearing from clients, what are those, what the biggest red flags of you need to get out? Like, or like you need to just like look for something. Yeah. What are your biggest things?
Well, my number one thing, which I understand, like people have different beliefs with training dogs, but I do not need to hear a vet's opinion on the way that I train my dog if it's not ethically harmful for my dog.
Yeah.
And I went to a vet one time and my dog was on an e-collar and they're like, you know, that makes your dog's anxiety worse. And that bold statement, my dog wasn't anxious at all. She's not an anxious dog. She loves everybody. Is instantly like a turnoff, and I was like, this is not the right place for me because I should not be hearing your opinions on training when you have no education on training. And people take their vet's word a lot of the time. They're like, oh, the vet knows everything. In vet school, there is no formal behavioral aspect of it, like maybe a little bit, maybe a class.
I think they get like a 2-week, if I'm correct, it's like a 2-week how to read body language. Like it's in the aspect or the context of like how to keep yourself personally safe and read a dog who's giving you signals that like they're not happy or uncomfortable or whatever. But it's not like how to behaviorally modify a dog or, you know, things like that. Yeah. They're dealing with medical stuff. It's the same way that like I wouldn't go to a physician with an MD or whatever, and then be like, I have depression. Can you give me therapy to treat that? They'd be like, no, go to a psychologist. Or, you know, a psychiatrist or something like that, because they're like, if you have cancer, I can help you with that, but like, I can't help you with like your brain being weird, you know? So I agree with you that I think they overstep their bounds quite a bit on that. Some of them.
And it's just definitely inappropriate, and it doesn't have a lot of place in the appointment of your dog. Like that's something that will always make me like, I need you to not say anything or, you know, listen to how I best know my dog, and I know what my dog's triggers are and how I can help you through that, and we can work together rather than you demonizing me for the way that I train and then kind of writing me off from there.
Especially if it's not the reason you're there.
Yeah.
You know what I mean? Like you said, they just went out of their way to be like, that thing is going to cause you issues, when it's like, I'm here for a vaccine.
And it was literally like Sunday, and Sunday is like, loves people, and she loves going to the vet, and there was just no place. I would get maybe if the dog were very highly anxious and I were overcorrecting the dog at the vet, that they may say something. But in that context, I didn't feel like it was appropriate.
Considering you didn't have to actually correct her at all, and like they weren't. They were just assuming you were misusing it. And,
Well, because I feel like behaviorally, or like in the training aspect of things, like if I'm working with a vet, I want them to either have no opinion or to be supportive of what I do with my dogs. I don't ever want to walk into a vet's office and feel like I'm already uncomfortable because you're already viewing me a specific way. And if you view how I train my dog as inappropriate or even as far as abusive, then you're definitely not going to give me the benefit of the doubt when it comes to the health and care of my dog.
Yeah.
You know what I mean? So like that is a massive red flag for me, because if you already think I'm a terrible dog owner because I train a certain way, then if I come to you and I say like, hey, my dog's behaving this way, or maybe I have concerns about a specific vaccine they want to give, or I have questions or whatever, they're automatically going to communicate and look at me through the lens of like, this person who doesn't care about her dog because she uses this type of training still doesn't care because now they don't want to do this vaccine, or you know, whatever it is. So I feel like if they've already shown you that like they're not supportive of you, again, maybe they have no opinion, and that's fine too. Honestly, I kind of prefer that route that vets take. I like when they have no opinion,
It's
and
a
if you
mindset.
ask, exactly, and if you ask, because I know a lot of people ask their vets for training advice.
Yeah.
I get that a lot of times it is the clients initiating the conversation and not just the vets going out of their way to give their opinions. I recognize that. But I appreciate vets that have like all of the options. Like I've gone into vet clinics where they have force-free training pamphlets, they have some balance training pamphlets, like they have all of it. Because they're like, it's not our job to decide what route you should go down, but here's some options. You know, explore what you think you like the best or what's going to work best for you.
Well, and I think personally too, it's something that, I don't know, and anyone that's willing to go through training or, you know, try to help their dog, whatever way that may be, I see that as helpful, right? I see that, I personally, I just think that like any sort of training is you're trying to help the clients, and that's something that I've always like thought of with dogs going to the vets and everything, is like I just never really got why a vet would ever give a client like crap for having e-collar or just doing any sort of training or having any sort of control in the appointment, because if the client knows that their dog is difficult, whether again anxiety or, you know, they just crap all over the floor or they try to bite the vet or whatever, you know, if the person's trying to help that person calm their dog and work through stuff and everything, I've never understood why the vet still feels the need to kind of like put their 2 cents in, you know?
Well, I think some of the issue is, if you think about it, so like say you do have a dog who is working with some bad aggression issues and anxiety and fear and all this kind of stuff, you probably have a hard time like nailing down a vet who will want to work with you. You know what I mean? But then beyond that, I think this is a problem in all contexts, whether it's social media, real life, vets, whatever, is that people think that the dog that they're looking at is in the worst like space that they've ever seen it exist, and so the immediate factors that you see involved are causing that behavior. Whereas what I mean by that is like Buckfield, for example, like you pointed out in that one video, people being like, Buckfield looks terrible, he looks so anxious, and you're like, this is eons better than where he started. But they don't have that context. You know, so they're like, the e-collar made him that way, and it's like, dude, since we've started using the e-collar, he's better. Like, if you looked at what he was like before.
He still has a way to go, but...
Yeah, but like, the progression is there. So it's like, you think about in a vet setting, like Lumos, for instance. If I take Lumos into the vet, and he growls or he shows any sign of discomfort or aggression, and this is the first time that vet has ever seen him, and they see a muzzle, an e-collar, and all these things, she could very well be like, that's the reason your dog's aggressive. And in turn, I could be like, no, this is the reason he's not ripping your face off. This is the reason you're getting a little growl and not like a full-on mauling situation.
And I think,
but they don't have that context of like what it used to be to compare it to.
And they're also seeing your dog for less than an hour in a very heightened state where your dog is nervous because previously your dog gets poked with things, maybe they had a bad vet experience, they've been spayed, they've been neutered, been under sedation. So we also have to take into account that we're putting our dogs in a very stressful situation, and to think that things are going to be rainbows and butterflies and we can solve it with Prozac and Trazodone and drug the fuck out of our dogs is so unrealistic.
Yes.
And just so harmful of a ideology to think like, I have a client recently that was like, we were instructed for 24 hours to trazodone our dog prior to the appointment, the day of the appointment. And it was this massive amount of trazodone.
Yeah,
for
and
them to
gabapentin.
give. Yeah.
I had clients that were told to give their dogs gabapentin for vet appointments.
And that's so harmful. And I have a theory too that when your dog is drugged and we're taking them someplace, what association does that make? That they're feeling off, they're feeling wobbly, they're feeling weird, and then they're going to this place where people that they don't know are touching them, and they're very vulnerable. So we have to look at what's happening.
Right. That's where you get the stories of, well, you know, we gave him a shit ton of trazodone and he actually seemed worse, or she actually seemed worse. It's because you are putting your dog in a situation where sober, it's going to be super stressed out, but then you put it in a non-sober mindset, and so it's even more on edge and stuff and anxious, and so you see more aggression, you know,
because there's a reason why drunk people are more violent.
Right. Yes.
There's a reason, because you have no inhibitions anymore. You know, it's the same with dogs. Like, you're trying to suppress aggression with sedation, it's not going to work.
And I get that, like, a mass majority of vets, like, you have to deal with the dog in front of you. So in their minds, like, that sedation is easier so they can get their job done.
Yeah.
And they can't really rely on the owners to be doing the work at home, muzzle and conditioning their dogs and getting them used to handling, because a majority of owners don't know how to do that, nor do they take the time to do that. And there's just a lot of, like, misinformation. But to be in a trusting role where somebody's trusting you with the health and welfare of their animal, being like, medication, I think is awful.
Well, and I wonder if part of it is, like, vet offices that are, like, privately owned practices. Obviously, there's chains and stuff like that where they probably have less power to make these decisions. But, like, you can pick what clients you don't want. You know what I mean? So it's, like, the same way that, like, if we ever encountered a client here that was, you know, behaving in a way that was dangerous because they were unwilling to do certain things with their dogs or argue, whatever it might be, like, okay, we're not a good fit for you. You know, you can go find somewhere else. But, like, with vet offices too, like, if you want quality interactions with your patients and you want to see dogs improve as a long-term process and not just, like, what do we got to do to get through today, like, recommend, why don't we do training and all this kind of stuff. And if you have a client who repeatedly keeps coming back and nothing is improving and nothing is changing, don't let them come back anymore.
Right.
They can go find somewhere else.
Yeah.
You know what I mean? Because I think there's a lot of, because I mean, in the veterinary industry, like, they take so much shit from everybody all the time.
That's why, like, suicide rates of vets are very, very high.
It's the highest profession of suicide.
Yeah.
So it's like, I get it. It's a very difficult industry to be in, and I'm sure the burnout is insane. But I almost wonder, and I'm sure it's way more nuanced than I'm making it, but I would imagine a step in the right direction is just not tolerating it from people. You know, if you have somebody who comes in and is throwing a massive fucking fit because they don't want to pay their bill, okay, then kick them out and never let them come back.
Yeah.
And I think it's because a lot of people that get into animal care do it because we love the animals and we want to see them do well and prosper and be taken care of. But that leads to you getting taken advantage of and being treated terribly because you allow yourself to be put in situations where people disrespect you and they don't value you.
Yeah.
And it's like, yeah, I'm sure it would be really hard to turn away a client with a suffering animal because they're being a dick. But also, like, you have to prioritize, like, your longevity in that career field and how you're going to be able to have the most long-term success with people at that point.
The compassion fatigue is very, very real.
Yeah.
And nobody deserves to be treated like screaming at. Like, I would never accept that from where I work, where nobody's ever screaming at me, cussing at me, calling me names, anything like that. That's not going to be tolerated.
No, not at all. And I think we're fortunate to work somewhere where we would be supported in that. You know, like, that's not going to happen.
Yeah.
But I think that that's something that in animal pet care in general people need to start standing up for themselves more.
Yeah.
And being like, yes, I want to help the animal, but I will not tolerate an owner like that.
Mm-hmm.
And I won't put myself in a position to be taken advantage of like that either.
So then so going off of that, then I have another kind of question too. From the client's perspective, right? How would you maybe suggest for someone who doesn't usually have that strong voice for themselves and everything, suggest going about if the vet is, recommending this is what you should do, or the e-collar is really bad or whatever, right? Are there any things that you would suggest maybe trying to say to that vet, or would it be best just to kind of leave? Like, in the sense of them saying, okay, make sure you're doing trazodone, make sure they're doing this because we need them to be sedated so we can handle it. Is there any point in saying, I really I've been doing training, I just want to try to do this and I don't want to do the trazodone?
Mm-hmm. I think so. I mean, I think that maybe some vets go to that because, again, they're probably stuck in this cycle where maybe they are dealing with people who don't really care and just want to get it done by whatever means necessary. But it probably is worth a conversation to say, I'm working with a trainer. Can I talk to them, see if they recommend anything to make this go better next time and avoid medication? And I think if you bring that up and they respond and they're like, yeah, that's fine, whatever the trainer feels like they need to do. Or I know that we've even done sessions at the vet office, and stuff like that, and some vets are great about allowing that and kind of letting us come in. I feel like if the vet is open to it, cool, then I would probably give another chance at that point. But if you get any type of pushback or negative feedback, then I would say go find somewhere else. Yeah. It's just not worth the energy.
It's 100% okay to ask why and question your vet. Just because your vet is offering medical advice does not mean that you need to take their bullshit or their questioning or their interrogation of you as an owner. And if personally, for me, if my vet was like, what is this e-collar? I'm going to do this medication, I would be sassy and I'd be like, excuse me?
Yeah, for sure. 100%. For me, so how you opened this up initially, Seamus, you were like, what are your big red flags for a vet? To me, I think what immediately popped into my head was any type of deception. Or anything other than 100% transparency and creating an environment where I feel like I can ask whatever question I want and you're going to give me a thorough, knowledgeable, educated answer, and you're not going to invalidate how I feel. You're not going to laugh or think I'm silly because, maybe I saw a bunch of posts of people having weird reactions and now I'm asking you about it. It's not your job to make me feel silly for seeing information, being concerned, and asking a professional, should I be concerned by this or not?
Right.
You know what I mean? So to me, it's I feel like you're not creating an environment where we can have an open discourse and I feel respected by you, then I would not go there anymore. At all.
I want to know that you can answer my questions without making me feel stupid and weird about it. And just give me a run-of-the-mill answer. If I'm asking you, why leptospirosis? Why in small dogs? Why do I need to get that? Instead of being like, well, she just needs it because she might encounter animal urine and drink it. I want to be like, well, these are the side effects that could happen that have happened in clinical studies, but this is why we recommend it, and ultimately it's the owner's choice to make that.
And I think that's key that you said recommend.
Yes, if you recommend something, cool, and if you can back it up and tell me why and give me good information, then allow me to compare it. You don't know my lifestyle with my dog. Pip, when is she realistically really gonna encounter animal urine in a large enough amount that you're gonna get leptospirosis?
Yeah, and
very rare.
The risk of the side effects from that medication would have been higher than her chances of contracting leptospirosis.
Yeah, to me, there was a vet office that I used to go to, and when things really went downhill, there was a specific vet I went to. that I liked, and I always requested her and I liked her, but she left, and I can only imagine it's because the practice sucked in general. And so she was gone. I had to go see a couple of different vets, and like biggest red flags for me then were I literally went in to get Snoop his booster for his distemper parvo, and because it was the last one he needed, because I think with his breeder they get the first 2 I think is what she does. So his last booster he needed. And I specifically said I wanted the one without lepto, because there's a distemper parvo vaccine that they loop in lepto in and out. Most of the vaccines your dogs are getting these days is like a massive amount of everything in one. So basically it's like DHLPP is the acronym. If the L is in there, that means that they're getting lepto in another vaccine. There's also DAPP, DHPP, and all these different ones. But I told them, I said, I don't want lepto. She comes in with the vaccine and stuff, and I look at and I said, can I see it? And I'm so glad that I asked to see it, because they had the one with lepto. And they were literally going to give him the one with lepto, even though I specifically said not to. A 6 to 7 pound Chihuahua at that time. And I absolutely lost it. I was so mad. And the vet tech was like, oh, I had no idea, because I spoke to the vet about it that I didn't want, and the vet tech came in with it. And I said, I specifically said I didn't want the lepto one. She's like, the vet gave me this one to give you. Like, she just really recommends that you get the lepto. And I said, you were literally going to inject my dog with something that I specifically said I didn't want and not going to tell me about it.
And clearly you knew of it. Like, it'd be one thing if it was just like, you never said anything, and then they're like, oh yeah, this one. You're like, no, I don't want that one. They're like, well, this would be recommended. Right, it's like
they intentionally
you clearly knew that you didn't want the specific thing for whatever reason, and that's for your reason to care.
Yeah.
But for whatever reason, you didn't want that, and they still chose to do it.
Yeah, and so I was furious.
Yeah.
I lost it, and I was like berating this poor girl in there, and she goes and gets the vet comes back out, I'm talking to the vet about it, and I said, honestly, like, how fucking dare you? Like, this is insulting, you know? That, like, if you wanted me to care about this or get this, have a discussion about it.
Right.
Talk to me
Don't
about
try
it.
to sneak around it.
Yeah, exactly. So I didn't even get him what he needed that day. I just left. And then I went somewhere else to have it done. And because it's scary. And there were a couple other times I had to go there for things that the vet I go to now is like 45 minutes away, which it's worth driving that far because I really love her. But because she was so far, there were a couple things I needed to do close by, so I went to that other vet again, and I went in full well expecting like arguments the whole time. But I go in, and again, it was like I wanted to have like x-rays done, and she's like, oh, well, we need to do this vaccine, and you need to do this, and you need a heartworm test, and you do this, and I said, I'm just here for the x-ray. I said, I have another vet that I go to for all of that stuff, just here for an x-ray. She spends 15 minutes arguing with me on why he needs to get vaccinated for Lyme disease. And I kept asking her, I was like, can you give me the support? When was this vaccine created? How old is it?
Right.
What are the benefits versus the risks? Like, why should I get it? Tell me why I should get it. And she either couldn't or she didn't care enough to actually give me any valuable information to make me feel comfortable making that decision. And again, it just felt insulting. It was like, you're a little tiny civilian who doesn't know these big sciencey things, and I'm not going to explain it to you, and you just need to blindly trust me and let me do whatever you want to my dog. And it's like, I'm not going to do that. The vet that I go to now, so Lumos has chronic kidney disease at this point, and so we're doing regular blood work, and we're doing all these things. She will sit on the phone with me for 20 minutes and go over all of the numbers and be like, so this is at 5.2, and it used to be at 5.3, and what that means is this is dropping. So that means you're doing a good job with his diet. Or, you know, like all of this kind of stuff, and it's like, that's who I want to feel like I'm working with. As someone who cares enough to make it a team effort. And recognizes that it has to be a team effort.
Because like working in the dog industry, whether you're doing daycare, training, going to the vet, anything else, volunteering at a shelter, I want to know that the people in charge or the leaders of that place can take my questioning, can go over things with me, and it can be very constructive and respectful, and I don't want an argument. Like, just like how the services we would offer for a client that was questioning, well, why do I do it this way? I'm happy. It doesn't annoy me in the least bit to take the time to answer. And I get that these vets are maybe seeing 10, 20, 30 dogs a day, and it can get a little tiring, but you have to have room to take that time to talk to your client, and that's what makes a good vet. And not answering things or being rude is never gonna be in your favor.
No, not at all. And I think, so from the behavioral aspect of things, like, I think it's important when you're finding a vet that you feel aligned on what your values are medically. You know, if you want a vet who you are just like, tell me what I should do and I'll do it. You know, you can find vets like that. If you have a very, like, you want to feel very informed on, like, why do they need this vaccine? Can I just do blood work and do titer tests instead? Can I just do, you should never feel like your vet isn't open to giving you all of your options. You know, if you ask for it. And then on the behavioral side of things, like, I just recently had a client reach out to me that she needed to purchase a muzzle because her shepherd started showing a little bit of, like, fear aggression at the vet and stuff like that. And I talked her through, I kind of got the story of, like, what happened, and she's like, well, he was uncomfortable, so they were trying to, like, hold him, and that's when he started getting more aggressive and snapping and stuff. And I was like, well, are you willing to try? I said, 100% you can muzzle him. I said, but I have a feeling that if you just put him into a down command and just hold him accountable for his down command, he'll be fine. And she's like, well, I tried to correct him, and they yelled at me and told me not to do that again. And I said, then you need to go to another vet.
Yeah, that's like,
that is the line right there. Like, if they're not going to trust that you know what is best for your dog in that way, when you have taken all of this time and energy and money and invested that into training your dog, and your dog is impeccably trained, and you know your dog's personality, and you know that would have worked and helped the situation, and yet they felt so quick to reprimand you and treat you like a child, you're gone. Go somewhere else.
I recently, like within the last year, had a dog that had extreme high vet anxiety, and the owners were, like, beside themselves because anytime this dog, she had something medically wrong with her that she needed to go to the vet pretty often, and it was like wreaking havoc on their lives. I met them at the vet, and they're, like, shaking before they go in, and the dog is muzzled. They did all of their due diligence to get this dog conditioned. We take the dog in. Instead of allowing the dog to go under the chair or hide or start performing these nervous behaviors, I held the dog accountable to the downstay, like you were saying, and the dog did phenomenal. So much so that the vet came, like, I think David was there earlier or later that day, and the vet said that we're welcome there anytime. And that's how you should do it.
Yeah, 100%.
You should be accepting, and they were like, very shocked that the visit had gone so well after years and years of horrible vet visits with their dog, because it's not only stressful for the dog, it's so stressful for the owner too.
Oh yeah.
Well, and that goes back to, like, again, they're clearly trying to make it easier, obviously for the dog, but also for the vet. You know what I mean? It's you know, for the techs or whatever, right? It's something where it's just like, just let me do what I do with my dog, right? And then you can come in and do it, but I know my dog way better than you know my dog. It's something where it's like, let me do my thing, right? And then, and if there's things of, like, you know, small things of controlling or correcting, like, let me do it, and you can do your job. Your job is to give the vaccines and to do the physical exams and to do whatever. My job is to make sure that my dog feels safe and comfortable.
And if I'm making things easier for you, then why do you have a problem with it?
Right.
Like,
that's what I was saying earlier. That's what I don't get, is how the vets or how people can kind of, like, and this just goes even outside of vets, just anyone in general. Like, if you were just walking your dog down the street, who are that person to give you shit? Right. When you are clearly trying to work through something, right?
And they've met you for 30 seconds.
Yeah. They don't know your dog.
It's
and then
ridiculous.
They're seeing the worst version of your dog in the moment because your dog's in this heightened state, and they're like, oh my god, this dog needs Prozac and all this
Yes.
long term.
And if so, like a situation like I just described, and I've had other clients run into the same problem where the vet team will just hijack and just ignore the owner saying, no, that's not going to work, don't do that, it's going to make it worse, whatever, and just do it anyways. Whether it's like doing physical holds and things like that. And I told clients, I'm like, that's when you say, enough, I'm leaving.
Yeah.
Like, if it's gone past the point where there is going to be there's nothing productive that's happening here, and they won't allow you to do what you know is going to work for your dog, and instead they're doing whatever they want to do instead to just muscle through it and get it done, you have every right to say, stop.
Yeah.
This is my dog. I'm done. I'm leaving. Like, I'm not doing this anymore.
Right.
Because they don't have a right to just take over.
Yeah.
At that point.
Yep.
You know, like if you look at how many clients do we hear that, oh, the vet refused to do the dog's nails, or the vet thinks the dog needs completely sedated to do their nails. And it sometimes is a process, and the dog is fearful or has an aversion to being touched or getting their nails done. But how, with our sessions and our training, that we can work through that. And at the light at the end of the tunnel, we're seeing that the dog is not having this terrible response to getting their nails clipped anymore.
See, and nail trimmings at vets, I don't agree with. I don't think vet offices should be trimming nails at all.
No.
Don't even offer it. It's not your job.
So you're going to pin my dog down and then be like shocked when it's screaming and biting you.
Yeah.
And
Again, it's not into that
And it's
profession.
not, it
It's-
isn't. Let a groomer do that.
Yeah.
Let a trainer do
It's
that.
the whole point of that
Don't
career.
even offer nail trims.
Yeah.
I
Imagine
don't
if
get it
vet
either.
offices just stopped offering it. They would have, that would probably remove
Yeah.
a ton of their issues and the responsibilities that they have of dealing with really aggressive
It's
dogs.
because they can rope people in by saying, well, this dog needs to be sedated, so they have to be here to be sedated so I can do the nails.
And we're
Yeah.
like fed this lie that our vet is everything, and they know they're the end all and be all, the god of our dog's care, so we should listen to every piece of advice they have. And how many times have we heard in the past that people start training with us, they go to the vet, they call us in tears, and they're like, my vet said that this collar was going to cause irreparable damage to my dog, and we're like, I've heard this many times before, and they come to us and they're very shocked.
Yeah.
And your
2-3 sessions later, they're like,
your vet should not believe.
Well, and even medically, so like a good example of this is like that original vet office I was going to was the blood work. I was doing senior blood work for Lumos for quite a long time, and that's what caught the levels for his kidneys being a little wonky right away. And they told me that, you know, he has kidney disease and that you can change his kibble. And that was the only options they gave me. I'm like, well, what does that mean? Like, is he dying in 2 months? Like, what's happening?
Yeah.
And they're like, well, you can change his kibble and that should help. And we'll check the blood again in 6 months. And I'm like, what? The vet that I'm going to now, he's literally he's on a prescription kibble. He gets distilled water. He has omega-3 supplements that he takes. And he has another set of kidney-specific supplements that he takes. And specifically the omega-3s and those kidney supplements, when we started those, his levels completely reversed for a while. And they were getting exponentially better. And now they're just like steady. So it's not like it magically made his kidney disease go away, but like it's holding steady. And he's been living with his kidneys declining now for over a year, which for most dogs, that doesn't happen. You know what I mean? Once they're diagnosed with kidney issues, it's like very downhill very fast. And I would imagine it's because all the options they're being given is just change his food. They're not being told.
An answer.
Yeah, it's like they're not. So all vets' knowledge on things, it's not created equal. You know what I mean? That's all that taught me.
Schools are different, where they're going to school, what they're practicing. The vet themselves, their personality, all play a role into things.
Yeah.
And at any point, you were allowed to decide that that isn't a good fit for you.
Yeah.
And you're allowed to change clinics, and it sometimes is a pain in the ass, but the wait to get the new appointment. But it's so much more worth finding a vet that you can call up anytime and they're willing to answer. Like, I have this absolutely incredible vet I've been going to, And several times, having dogs, things come up, and I'll call them, and they're like, "Can you come in at 3:00?" And they're there, and they're able to answer all of my questions, and they're not like making me feel like a hypochondriac with my dogs.
Yeah.
And they've been there for me.
Yeah.
So.
And if your vet ever makes you feel like guilty for either doing something or not doing something, or whatever your choices are with your dog, that is a big red flag for me too. Because like when Barney was declining and he had what was very obviously that cancerous growth on his side and everything, at another vet I went to, I was told, oh, you need to pay $1,800, have him put in full sedation, anesthesia, get it removed, biopsied, like all these different things. The dog was 13.
Yeah.
Like, realistically, what is the financial investment into a 13-year-old dog who is like a 65-pound dog? Like, that's a very long lifespan for a dog of that size.
Yeah.
And the vet literally sat me down and was making me feel guilty for not wanting to proceed with something like that. Because I said, okay, if it's cancer, I'm not going to treat it.
Right.
Because he's 13. Like, why would I make him and extend his suffering with all these cancer treatments when I just want to make him comfortable and make a decision at some point if we have to? And then again, at the vet that I'm at now, she literally had him come into her clinic. She did local anesthetic, snipped it off, sewed it together so the thing was gone. She was like, I don't even see a point in biopsying it, because she's like, you're not gonna treat it. You know what I mean? She's like, so let's just get him on some things to make him comfortable, and if it grows back, like, we can cross that bridge if we need to.
Yep.
Amazing.
Yep.
Like, you should never feel guilted by your vet in any way.
Yeah,
like, that's just very unfair.
I recently had a friend, and she was having trouble affording her vet bill, and she was at the vet crying. And she said, well, I told the vet I can't afford that. And she told me that the vet said, well, you can sell your cell phone. And like, it made her feel like bad about it. And she called me and she was like sobbing. And she's like, I mean, I can sell it. Like, and I was like, no, absolutely not. Like,
That's insane.
That is so.
And listen, like, there is, yes, when you get a dog, you should recognize that there's going to be a certain amount of financial obligation. And you should try to prepare for expenses that come along with that. Pet insurance is such a good, valuable thing to have at this point, especially I only even have the pet insurance that covers emergency stuff, like you use Trupanion, so like anything routine it's not going to cover, but like emergency situations, the deductible I think I have is like $400, and then they cover 90% of everything else. So like, it's incredible. And so that's a good option. And if you get that right away with your dog, especially if they're young, your monthly price is like, mine for Snoop is like $30. It's like very reasonable. It's harder if the dog is older. Of course, if there's already documentation of like pre-existing issues, it gets dicier. But like, if you have a new dog where nothing's been documented, get pet insurance right before. But with stuff like that, it's like, it's so sad that it's unreasonable to think that you're going to be able to financially support everything that goes wrong with your dog.
Yeah, because it's
or be expected to.
Yeah, you don't even know what could go wrong. You don't know until you know.
Exactly. Because like, I just had to get, and that was another thing too, is like when Lumos, because when I switched vets, actually, she told me, she's like, this hasn't progressed to actual kidney disease yet. She's like, it's just like, things are a little wonky. And it was just like, what was it, 2 weeks ago? That finally she's like, okay, it's like kidney disease at this point, that's chronic. And she was like, but that doesn't mean it's like over. She's like, we can do this test where if he has a certain protein in his urine, he can actually start a medication that can like help with that and stuff like that. So it's like, there's just so many options out there for a lot of different things that can be affordable if you're working with the right vet who isn't trying to just like.
And she's clearly expanding on the options too, and not just, well, this is the one option.
Yes.
Do it or leave.
And explaining,
you know what I mean?
like, if you're going to purchase those expensive tests, what she's looking for exactly.
Well, and what was wild too, and this was like, again, just solidifies how much I appreciate her ethically is that, so when I took him in to get that blood drawn for that blood test, and I took in the urine sample and stuff, she ran everything in-house and noticed that what needed to be found in the urine to be worth sending it out to the lab that would have cost way more money to actually test for if he needed medication actually wasn't even present at this point. So she calls me and she's like, I credited that amount you paid me to your account to use at future appointments because we don't need to send it out.
Yeah.
And it's like, she didn't have to do that. I wouldn't have known any different.
Yeah.
Right.
You know, and now I have like $200 credited there that moving forward I can use because she knows I'm like,
That's awesome.
you know, spending all this money on the dog at this point. But
It's important to find, like, obviously there are good dog trainers, there are bad dog trainers, there are wonderful vets, there are bad vets. And it's your job as the owner to find something that makes you feel comfortable, that your dog feels comfortable with as well, and that you feel comfortable discussing options with. And it should never be like black or white, like, no, we don't support e-collars because we're wanting to push medication and support the pharmaceutical companies. And
or
just,
if your dog ever gets a hot spot from an e-collar, if your vet said the e-collar burned them, go somewhere else.
Yeah.
That at that point
That's
is just complete
That's a big one.
ignorance at that point.
Yeah.
Like, even a vet who doesn't agree with e-collars should know better than that.
Yeah.
It's a pressure sore. It's not a burn. Like, to say something that absurd is wild. Absolutely wild to me.
I mean, if
I
we...
have a question.
Oh, yeah, go ahead.
Yes, Sunny.
So at West Park, they have at West Park they usually like bring in the dogs for their appointments and not have like the owners with them.
That's a
How
good point.
do you guys like feel about that?
Yeah.
That's actually a really good question.
The vet that I go to actually does that. She'll take, I'll go in with them and stuff, but she'll take them into the room with her and the tech, and she'll do what she needs to do in there. But she's never, it doesn't feel secretive. If you have a bad gut feeling about it, I think you should trust your gut. But like, I've stood literally right outside of the door. I don't hear anything weird, anything like that. But I do know that some vets prefer that because there is validity to some dogs behave worse when the owner is around.
And it's hard for sometimes the way that they're handling or getting blood jugger.
Yeah, because Lumos has to have it taken from his neck.
Yeah,
because
from the neck.
whatever his veins or whatever are just not great elsewhere. So. And I know that the one day I took him in that the tech wasn't there and I had to assist her for the blood draw, he was worse when I was in there. And he was a little bit more grumbly and stuff like that. And she even told me, she's like, unfortunately, you know, she's not here to help me today. She's like, but I will have you know that he never behaves like this usually. And it was just because when I was there, he was a little bit more like sassy about it, I guess. I don't know.
Yeah. And I try to avoid going to huge practices like that. Like, it's a great emergency hospital if I need it. But I kind of want to be there.
Yeah.
And then there's an aspect of the vet appointment where they do take my dogs away to get that blood. But sometimes if they come back to you and they're like, oh, they were acting horribly, and then they can't elaborate on why, what were the triggers, were you touching his nails, were you giving him the shot and he acted horribly. And I don't want to feel like it's secretive at all. I want him to be like, well, when we want to go give him the vaccine in his back, he reacted. It's like, well, fair.
Yeah.
You know, they're being poked with something.
Or if you got like a sore leg or something and they didn't know, it's like, okay, yeah, that makes sense.
Yeah,
you know?
or it's just off topic, but anytime I've gone to that hospital, like sometimes we've taken dogs there, and if you look around, the vet tech's just absolutely being dragged by these dogs. They have like they're like shooting through the parking lot. I'm like, do you guys have dog handling skills? Like, I know that a strong puller is a strong puller, but the way some of these girls are flying around the parking lot, I'm like, girl.
I know. I'm like, just slide that up a little higher.
I know. And they're just like, woo!
Oh my God! I'm so happy to see you.
Yes. I also think I know that we have to wrap this up here in a second, but I think it's also important. It's important to me at least that the staff respects, like if there is clear like boundaries I lay out about my dogs, that they respect it.
Yeah.
So I've told the story a number of times, but in times where I've told them like Lumos is not scared, so don't baby talk him, don't do like soft body language, nothing like that, because if anything it's going to trigger him even more. Just be confident in your movements, behave as if he's not even there, do what you need to do, and he'll be fine. And blatantly ignores me and starts baby talking and like getting in his face and stuff like that. So that stuff to me too is important. I want to feel like you actually respect my opinion enough to believe me.
Because again, who knows that dog better?
Exactly.
Right?
Exactly.
And I mean, I guess the last point I'll say, which is, I'll try to keep it short here, but if we're playing complete devil's advocate about owners, I'm sure that the vets deal with a wide
100%.
variety of extremely ignorant people, extremely rude people, to nice people. And I'm sure in instances they feel like maybe this dog had no formal training with the trainer and they're using an e-collar and they feel it's inappropriate. Of course, it's okay to, give your opinion if
Elaborate.
you feel, and, give a recommendation.
Yeah.
But if my dog is acting calmly at the vet and they're okay, I don't want to hear your opinion.
No. And I truly think that until, again, I think it comes back to, I wish that establishments would not allow and tolerate that behavior. And I think that if you want abusive behavior to stop in pet care services, you have to stop allowing it. You cannot give service to people who don't deserve it.
Yeah.
Care for your dog, vet care for your dog, training for your dog, boarding for your dog is not a right. You need to behave in a way
To make it a privilege.
to make it is a privilege. And if you want that privilege of us boarding your dog, or that vet taking care of your dog, or training your dog, or whatever it is, behave like a decent human.
Right.
And treat them with respect. And I think that we can complain about how people treat us all the time, but until we actually start putting our foot down and saying, get out of my practice, like I'm not going to be treated that way, or you're not going to treat my employees that way, it's not going to change. And you can't let your love for the dog cloud that overall principle of trying to make that overall change.
Sometimes you need to be a lesson for other people and check their behavior a little bit and not tolerate these horrible things.
Yeah.
Advocate for your dog.
Yeah.
Yes.
You know your dog the best.
Find a vet that makes you feel good.
Yes.
And, if something happens that you don't like, it's okay to talk about it, and it's okay to get a second opinion.
Yeah. Absolutely. Always ask questions. Always ask questions. I think that was good. Anything else?
I don't think so.
Anything else?
Yeah.
All right.
Thanks for
Cool.
joining us today, guys.
Yeah.
See
Hope
you
it helps
next
someone
time.
out. All right. See ya.
Peace out! Go Scout!
Can you get your dog?
Yeah.
And I was like, do you mind if I use my pet corrector right now?
Yeah.
And I did, and the puppy was like, whoa! And afterwards, they were like, yeah, so we probably won't be using the pet corrector.